Hello friends, I am Dr.S.Ashadevi, obstetrician and gynecologist. Today, let's address one of the most common symptoms in pregnancy, the hip pain and also the vaginal pain. Of late, we see a lot of pregnant mothers presenting with hip pain and they're not actually very clear about how to handle it. That's the main reason why I chose this topic. What is this hip pain in pregnancy? Medically, we call it the pelvic girdle pain. And what is this pelvic girdle? Normally, at the base of the spines, we have a ring of bones called the pelvic girdle. It consists of two pieces of hip bones which are joined together in the front and the back by joints. The growing baby and also the postural changes which happen in pregnancy can put this ring of bones to some sort of an unevenness, as a result of which the hip pain occurs. What are the symptoms of pelvic girdle pain? As the pregnancy advances, especially from the 7th month onwards, pregnant mothers can start feeling pain in the hip bones and also in the vaginal area, specifically in the bony area above the urinary passage. And when you observe yourself closely, you can start feeling that the pain worsens as you are walking on uneven surfaces, or whenever you are wanting to wear your pants, or when you are wanting to dress up when you are in a standing position, when you're trying to change sides on the bed when you're sleeping, and when you're trying to get into the car or get out of the car with one leg after the other. How can you manage this pelvic girdle pain? As much as possible, avoid stairs and also walking on uneven surfaces. When you're trying to dress yourself up, ensure that you be seated so that your hips are well stabilized before you're trying to wear your pants or trousers. And when you're trying to enter the car, ensure that you try and sit from the lateral side and keep both your legs into the car at the same time. And whenever you're trying to shift positions in bed, that is from one side to another, avoid rolling over on the bed. Sometimes even changing the pillows to the foot end side helps, and it makes your life easy when you want to change sides in the sleeping positions. Let me share with you certain simple exercises which can help you in tackle this pelvic girdle pain. We all know about these butterfly exercises. They have proven to be helpful to a very large extent in pregnant mothers who have this pelvic girdle pain. Whenever you're trying to sit in a chair, ensure that you sit in a neutral position. And what is this neutral position? Keep a small roll towel at the back so that your spines are stabilized when you're trying to sit in a chair. Next is torso rotation. Torso rotation is nothing but turning the upper part of the body on either sides, which will help in stabilizing and strengthening your hip bones. When you're sleeping, ensure that you have pillows in between your legs, and when you are trying to change sides, make sure that you keep both your knees together so that your hips are less exposed to too much of unevenness. The commonest worry all pregnant mothers with PGP have is whether normal delivery is possible for them. Yes, normal delivery is definitely possible, and having a pelvic girdle pain is not a direct indication for a cesarean section. Regularly performing such simple exercises and also engaging in physiotherapy can help to a large extent in overcoming this pelvic girdle pain, and also usually doesn't bother you much during the laboring positions. Thank you. Hope this video was helpful for you.